Hi, I'm Liz Hecht, co-director of Family Voices of Wisconsin. This video, Families as Advocates and Change Agents, is part of our video library for families. Family Voices is our state's affiliate organization and serves as Wisconsin's HRSA-funded family-to-family health information center. Our work is focused on three primary areas: development and dissemination of easy-to-understand information for families and providers via newsletters, fact sheets, and training; family leadership opportunities and support; and involvement in systems change and policy development initiatives. We are also part of a statewide network serving children and youth with special healthcare needs, supported by the Wisconsin's Title V program. Today, we are going to talk about families as advocates and change agents. While you may not think of yourself as an advocate or change agent, you've probably been doing this work on behalf of your child. For example, you may be interacting with your school staff or your doctor's office where you need to explain a situation, a problem related to your child, talk about solutions, and potentially recommend a course of action. That's being an advocate. You may have been invited to talk with your faith community about your child and help them understand why your child may be acting differently than other children and how they can be welcoming. You may be serving on an advisory committee. There are a wide variety of opportunities to do this. For example, every county in Wisconsin has an advisory committee for the Community Options Program. That committee's membership requires participation by families of children with disabilities. You may have been involved in a legislative process where you spoke at a public hearing or met with or interacted with your elected official to tell them about something that you think was a problem for you or in your community and the solution that you wanted to see. There are also opportunities to impact policy and legislation before it is enacted into law. Oftentimes, various departments of state government will post opportunities for public comment, where anyone can either send in or speak to a particular issue and the solutions that they see. So there are many ways that you may be doing this already, or that you might be interested in serving as an advocate or an agent of change. So why is it particularly important that families serve in these roles? You're really at the center of the way lots of systems are interacting or not interacting in ways that are helpful to families. So you see inconsistencies and problems that others may not recognize because they don't experience it. So for example, a medical professional is going to be speaking to you and making recommendations to you from their perspective as a medical professional, but they may not know very much about your day-to-day family life, what's happening at school, and the way in which their recommendations may or may not fit with other things that you're doing. You have valuable information to bring about systems change. You know what works and what doesn't work. Families are really good at managing budgets and coming up with creative solutions and great ideas to things that we need. And you also see inefficiencies and can offer practical solutions that others may not have thought about. And you can ask the question, could we at least think about this? It would make a huge difference to our family. So while there are many ways that you can serve as an advocate or a change agent, we're going to focus now specifically on legislative advocacy. Families and people with disabilities have had a tremendous impact on federal law, and those laws have created opportunities that have been absolutely critical in the lives of our children. For example, if we go back to 1975 and the enactment of what was then called the Education for All Handicapped Children Act, now known as IDEA, the Individuals with Education Act, prior to 1975, schools had no obligation to educate our children. And if they allowed children in school, they didn't necessarily have to provide any special accommodations or education to educate our kids. Now that's law. Our children have the right to an education just like any other child. Another law you might have heard about is the Americans with Disabilities Act. Prior to the passage of the Americans with Disabilities Act, people with disabilities didn't have a right, for example, to access voting places, to access courts. Kids didn't have a right to go into school buildings, or schools at least didn't have an obligation to make buildings accessible. So access to spaces in our communities and public spaces is essential to the civil rights of people with disabilities. The last one I'll mention is in 2010, the passage of what's called the Patient Protection and Affordable Care Act, also known as the ACA or Obamacare. This legislation was critical for healthcare coverage for people with disabilities. Prior to the act, insurance companies could say, sorry, you've got a pre-existing condition like Down syndrome, autism, cerebral palsy, and we're not going to provide healthcare coverage for you. They're no longer allowed to do that. So the involvement of families and people with disabilities in telling our stories and creating policy and legislation has had a huge impact on our lives. So I want to talk a little bit about why this is important today in Wisconsin. Every 2 years, the Wisconsin legislature passes a budget, and that budget pays for many, many things important to families who have children with disabilities, and really everybody else. So for example, the budget allocates funding for the Medicaid program. You may have a child who participates in Medicaid through Katie Beckett or the Children's Long-Term Support Waiver. The funding for this is passed by the legislature every 2 years. The same with, for example, the budget for regular education and special education, as well as road repairs, public transportation. All of these things are tied up in our state budget. The budget is a great time to have an impact on what's important to you, what you think should be funded and why. So the process typically begins the year before the budget is approved. So right now, the budget began to be developed in the fall of 2020, where the various state departments and agencies put together their budget requests and send them to the Department of Administration. The Department of Administration puts together what it's going to take to pay for those things, sends it on to the governor. The governor introduces his or her budget, usually in February of the year the budget needs to be approved. So that would have been February 16th, 2021. The process then moves to the legislature. The Joint Finance Committee is the main arm of the legislature that develops the budget for the full legislature to approve. The Joint Finance Committee is made up of members from the Wisconsin Assembly, Wisconsin Senate, both parties. They put together a budget beginning in February and usually has it done by sometime in May, early June. There's an opportunity as part of this process for public input to the Joint Finance Committee called Joint Finance Committee hearings. These will be taking place this year in April and are a great time to provide input into the budget process. Once the Joint Finance Committee finishes with the budget, they send it on to the full legislature, who also may make changes and then vote and approve the budget, which is then sent to the governor, who then also approves the budget. And that's usually completed sometime in June or July of the year the budget's approved. So we're right in the middle of this process now. The governor's introduced his budget and the Joint Finance Committee is now starting to draft a budget which they want to fund and send on to the full legislature. The reason, so this is a really important time for you to think about talking with your elected official. And one of the reasons is because if you don't talk to them, they aren't going to know what's important to you. They aren't necessarily going to know anything about people with disabilities or children with disabilities unless you educate them. And there are lots of people walking through that legislator's office every day who are representing a huge variety of issues. So oftentimes people who are paid to do this are called lobbyists. And as you can see from this slide, there is a great deal of money spent on lobbying every year. In the last legislative session, $34 million was spent on lobbying. 754 organizations were registered to lobby, and 667 lobbyists walked through the legislature and through the offices of our Capitol, educating legislators about what was important to them. They aren't necessarily talking about our issues. They're talking about what's important to their organizations. So you can see from this slide that most of the people, the top 10 spenders on lobbying, probably aren't talking about things that are important to us. So for example, the Wisconsin Realtors Association, the Credit Union League, the Insurance Alliance, et cetera. They aren't talking about people with disabilities or children with disabilities and their families. Nonetheless, your legislator wants to hear from you. We can't expect them to know about disability issues. They are generalists. They may see over 1,000 bills a year, and there's no way they can be an expert on each of those. So they really rely on their constituents to talk about what's important and to educate them what's about important. It's also, I think, really important to know that disability issues are bipartisan issues. They're not Democratic issues, they're not Republican issues. Everybody cares about people with disabilities. So whether your legislators are Republican or Democrat, they are there because they want to do a good job, they want to help people, and they usually want to be reelected. So you are a constituent who has a vote, and your vote could be for them or it could be for somebody else. So you matter to them. And it's also important to realize they're really busy. It's up to us to be really clear about what we want them to do. They may know nothing about our issue, and we're going to have to explain it oftentimes in a pretty short period of time to help them understand what's important. But we can't necessarily expect them to know it ahead of time. So one of the best ways to communicate with a legislator is to think about how we use part of our experience, our family story, in the most impactful way we can. Our stories are what help people remember what's important. If you think about kind of the things you remember, sometimes it can be facts and figures, but often the things that get to your heart are the stories that people tell. So we have stories to tell, and it can help a legislator have a deeper understanding of what's important for families and children with disabilities. It can make a problem real instead of abstract numbers and data. And hopefully it helps them make decisions that will be more supportive of us and of policies that are helpful to families and children with disabilities. Sometimes legislators have touchstones in their own lives. So you could even ask, do you have a child with a disability or a family member? Have you had a family member who needed extra care? And that can be a starting point for discussion because they may have had a similar experience. If you're interested in learning more about how to tell your story and deliver your message, we have, please go to our video library for families, and there is a educational video on developing your message for legislators. Thank you. We appreciate you listening to this video. If you want to know more about upcoming trainings, policies, or other timely information, follow us on Facebook, and be sure to check out our resource library and website with easy to understand information about healthcare and services for families.